But again, thanks to all of you for coming. This is an issue that we're way behind on and trying to get caught up. Senator Stabenow and I went to the floor the last day of October of 2013, which was the 50th anniversary of President Kennedy signing the Community Mental Health Act. And when you talk your way through that act and read your way through that act, a lot of facilities got closed as the act anticipated. The new alternatives didn't normally get open. And trying to do that now, Dr. Parks, you know, we have 8 states that are the pilot states in excellence in mental health. And I think, Dr. Johnson, I'll come to you on this in a minute and maybe others as well. I think what those 8 states will generally find out is that treating mental health like all other health, actually in the greater context of healthcare, doesn't cost anything. But because the other healthcare issues that the mental health community may have are so much more effectively and easily dealt with. But Dr. Parks, would you talk just a little bit about the plan you put together and how that plan in our state or other states could be implemented so that these pilots work in the best possible way?
Part of the power of the Certified Community Behavioral Health Center to reduce healthcare costs is that the Community Mental Health Center is not responsible just for behavioral costs, but for overseeing and coordinating all the medical treatment. So our community mental health centers in Missouri are monitoring people for their blood sugar control, for their blood pressure control, and that will expand and continue under the Excellence Act Certified Community Behavioral Health Centers. We have seen better control through this, as good a control of blood sugar through CMHCs as we see through the community health centers, the primary care clinics, and the community mental health centers have 30% people with diabetes as opposed to the primary care clinics only 15%. This is because people with serious mental illness have many more chronic medical conditions than the general population. They're required to have the whole range of services. So if you don't get better with just med visits and therapy, you don't just automatically go inpatient. You can get intensive day treatment. You can get partial hospitalization. You get assistance with transportation to get you in there with a cheaper ride than an ambulance ride to the ER. They're required to have after hours. They have to be open on some weekends, some evening hours, so people can get, if they are working some jobs, they can get in when it doesn't interfere with their work. And most of all, they don't have a disincentive to provide just supports and not provide treatment. Many CMHC reimbursements right now pay a better rate for supports than they do for treatment professionals. So community mental health centers don't have enough psychologists, don't have enough psychiatrists, don't have enough licensed therapists because they lose money on those. And the prospective payment rate system will be essential to making sure that treatment's as big a part to get them better as supports to help them get through with their disability. And
the prospective payment rate system, largely analogous to what happens now with federally qualified health centers?
Exactly. It is almost completely identical, and it's what allows federally qualified health centers to be able to get the staff mix they need instead of going with staff that are cheaper and therefore don't have the proper mix of skills. You don't want your business model driving the clinical decision of who's the best person to treat you.
Well, you know, the National Institute of Health says that 1 out of 4 Americans has a diagnosable and almost always treatable mental health challenge. And then asked at this same hearing last year, our NIH representatives said that 1 out of 9 adult Americans has a mental health issue that impacts how they live every single day. So this is not an isolated group of Americans. This is not something that every family in one way or another is likely to be dealing with some member of their family, either at their house or away from their house. But Dr. Johnson, you mentioned a percentage of, I think 35% of other healthcare costs go down.
Yes. Right. When we have the proper health home, and for people with very serious and persistent mental illnesses, often the mental health center is the best place to have the health home. And that's because we have, for instance, we offer hundreds of supported living houses and residential treatment options. But we find that if we take care of those problems well enough and quickly enough, that people don't go on to have out-of-control diabetes, they don't have repeated hospitalizations, they don't have repeated visits to the emergency department. And Senator Kennedy, I want to echo your concern about lifetime care. I believe even with serious and persistent illnesses, we should be thinking of episodes of care and helping people recover well enough so that they can have periods of independence or independence further on. We're doing this now, it's working, and I appreciate, Senator Blunt, how articulate you were about how the total health care cost doesn't increase, it actually goes down when we include effective behavioral health treatment.